Hello everyone, this is Dr. Clinton, and the reason I'm doing this short video is to tell you what are my 2 cents when I get sick. So I'm a doctor and I also get sick. I also get the upper respiratory tract infections. Remember that most of the respiratory tract infections are going to be 80% viral and approximately 20% or less are bacterial. So you shouldn't go directly to antibiotics. It's first viral, then it's bacterial. If it is non-remitting, or if you are on symptomatic treatment and you're just worsening, or you have pus or exudates in your tonsils, or you have a lot of lymph nodes inflamed here in the front and everywhere, and you feel way worse than you usually feel with a viral infection, and you are not having symptoms like muscular pain, diarrhea, headache, all these other things, it might be bacterial. So most of them are going to be viral. So what do you want to do? You want to treat the symptoms. So number one, if you're like me, that you like always working out, and I think that working out will reduce the infection and speed recovery. I would go against that. I've already tried doing that several times in my life. I just kept at it and I just gone to work out. And when you finish working out and when everything, your body just cools down, you feel way worse. That's what I've usually seen. And there's like a rebound inflammation. So what I would recommend you doing is, yes, stay active. That's great, but don't exert yourself. Don't do high intensity training. Don't exert yourself a lot. Keep up your workout, but reduce the load, reduce the physical activity. If it's a percentage, I'd say do 25% of what you regularly do. And yes, that's going to help you out and you won't feel that awful once you finish. And it could probably help you speed up recovery. The other thing I would recommend you doing is getting 15 minutes daylight every single day. So in the morning, that's going to be important to increase your vitamin D levels, and vitamin D is important for your immune system. Also, what are you going to eat? You don't want to eat crap while you're trying to recover. Most of us, when we're feeling down, will end up eating fast food, and that has happened to all of us. But as long as you can, try to eat nutritious food. Try to keep up eating the eggs as a good source of protein with like an omelette, or eat things that aren't ultra processed in general, because the more ultra processed, the more sugars and bad sugars and bacteria and viruses and all that love to feast on that and make you just feel worse. So I would recommend you get your vitamins, the leafy vegetables, get these nice colored fruits which are high in vitamin E, vitamin A, vitamin C, etc. Right? And you have to cover your bases. You also have to make sure you rest enough. So if you're working and you just want to power through it, and you feel horrible and you just want to go to work and you feel you're an incredible employee because you go to work with your mucus going out your nose with a face mask and feeling horribly, you're doing yourself a disservice, right? You're just worsening your long-term outcomes. So if you do these things, imagine you're feeling awful, you have all these secretions and everything. Maybe you can get away with it in your 20s, 30s. If you did this after your 40s, you could even produce yourself your own atelectasis in the lungs because you're not breathing deeply. And if you breathe deeply, it might cause a cough, but you're working with people and you're maybe in the medical field and you don't want to do that. And then you'll end up affecting your own life. So that's what part of the equation. The other part of the equation is, if you're going to be sneezing, coughing all around, probably if your employer is smart enough, they would prefer you to stay at home for you to recover, because it's not a good idea that you're working if you're feeling horrible, because if you're feeling horrible, that's the time you're going to be highly infectious. So if you're coughing all this, remember that COVID has been demonstrated to fly in the air. It's airborne. Influenza is airborne. RSV is airborne. Most of these viral infections are airborne. So you can cough right here, or you can have a face mask and cough, but all these particles will fly out in the air up to 5 meters, 8 meters, depending on how hard you cough and how much you protect yourself. But you'll get everyone infected. And what will happen? Everyone is going to be infected, and everyone is going to go see a patient and infect this patient. And if you don't have risk factors, you'll do well. But if you're going to infect a patient you're seeing that has diabetes, hypertension, obesity, grade 3, COPD, and is having new heart failure symptoms, you could kill this patient, basically, if you're passing on the infection to them. So you have to be mindful. Staying home doesn't mean you're just trying to get out of work. Staying home means that you are actually conscious and you are thinking on how to actually recover well, because oftentimes you're dealing with people. You don't have to be a doctor to just be conscious and understand that if you work in a call center and you go coughing everywhere, you'll get these people sick as well. The other thing, so you have to make sure you have to communicate with your employer and tell them, like, I'm feeling horrible, and that's it. You shouldn't feel bad about it. If you're in a place that telling them that you're not going to work because you actually feel horrible, you should really think of going to another place, because that seems like a pretty toxic environment. And yeah, oftentimes you have to be the first one to just say you can't go to work, because there's this social pressure, and everyone goes to work with mucus and coffee and runny nose, red eyes, but that's in the end doesn't make sense, right? Okay, so make sure to communicate with your employer. The other important thing is you want to rest. So that's part of the communication with your employer. The more you rest, if you're out of work, you have to prioritize sleep, rest, and take it easy, because that's going to help you recover quicker and get back to work quicker and maintain and improve the efficiency, and not just go to work for 7 days straight with an efficiency level of 20% or less than your usual self and get everyone infected. Instead, you probably might consider staying home 1 or 2 days, and when you're back to 85%, and in a couple days 100%. That makes way more sense. Okay, so rest, make sure to sleep. If you feel well rested when you sleep 8 hours, you'll have to get 9 hours now, because it's not going to be only 8 hours, because now you're just having these congestion and all these symptoms. You're going to wake up more times at night. You'll need more sleep. So for you being rested is 7 hours, you'll probably need 8. If it's 8 hours, you'll probably need 9. So make sure you do that and you cover that base. The other thing is, what else for your Okay, medications. Now let's talk a little bit about the medications. If you're having these symptoms, I would recommend you could use Cynorinse. So Cynorinse is something that will help you take out some of the secretions. I know some of you might think it's or don't like it because it's kind of gross sometimes to press in the water right here, and now here comes the mucus, but that's good. The cleaner you have your sinuses, the less risk for sinusitis and less risk for that to get infected. So one is I would recommend Cynorinse or anything that can rinse out your sinuses. You want the fluid that is in there to be isotonic, and by isotonic what I mean is it's the same concentration of what you have in your body. So you need a correct mixture of salt and bicarbonate, which are the most common ones, because if you just pour in water there, you'll see how it'll hurt because the tonicity, there's a disbalance in electrolytes from absent electrolytes to electrolytes in your body. So I would just recommend buying a preformed formulation. So I would do that. I would also try to drain those sinuses using, you can heat up water in a glass, or you can heat up water on the stove, and after that pour in salt, a couple of spoonfuls of salt, a couple spoonfuls of bicarbonate, and also I would buy this Vapor Rub, not the Vapor, Vic, the Vic pills that you throw into the shower that generate all this steam that you will inhale that will help you take out these secretions. I would also throw those Vic tablets into that water you're heating. Then I put on something on top of you, over you, and I would inhale that hot, all the mist or all the vapor, water vapor that is coming out, because this will help you like take out all these secretions, and that's what you want. You want to clean those sinuses, you want to clean the throat and all that, and that's a great idea. I would actually add in a guaifenesin tablet or an N-acetylcysteine tablet into the mix, because these two things will help you also. They're expectorants, so it means they loosen up the secretions, and the way they work is that they break disulfide bonds in the mucus, and by breaking those things, the mucus becomes more fluid and easier to go out of your system. So that's the recommendation. I would maybe add to that a little bit of lemon, and that's a great mix. The last thing we're going to talk about is which medications. So I already mentioned an expectorant. So generic names are guaifenesin or N-acetylcysteine. That has to be there in any upper respiratory tract infection. And the other option is going to be probably use NSAIDs for the initial treatment, less than a week. You just want to do 3 to 5 days of NSAIDs. You want to add acetaminophen because you want to treat the fever and the pain symptoms and a little bit of the inflammation. So you have NSAIDs, you have acetaminophen, that's going to be treating pain, fever, and inflammation. You want the expectorant to loosen up the secretions, and you want an antihistaminic. I would recommend you using Claritin, loratadine, desloratadine, these which are not, or fexofenadine, which are the generic names for the ones that do not produce the sleepiness symptoms, sleepy. And when you're at night, when you're right before bedtime, I would take the other antihistamines that do produce sleepy sensation, which will be chlorpheniramine, diphenhydramine, hydroxyzine, or doxylamine. Those are the main ones, the main generic names that will help you sleep better at night. And that being said, that's basically all I would do. If you are someone who has severe symptoms or you're over the age of 60s, 70s, what I do as well is I would buy myself an incentive inspirometer, because I want my lungs to be well aerated and not collapse at all, which when they collapse, segments can collapse if you're not breathing in deeply. If you have too much secretions, that can happen. So if you're old individual, you have many risk factors, or by whatever reason you're not breathing adequately, I would buy an incentive inspirometer to make sure you're actually inhaling well. I would do those exercises, and I would be mindful of my inhalation and fully inhale and do this 1 minute every hour. I would remind myself, or something if necessary. And the other option, if you don't buy the incentive inspirometer, is to buy, there's another one that is called I think it's the Acapella device, or something like that, which is basically the same idea of maintaining your lungs open, but this time it's just by breathing out into these apparatus. When you breathe out, it has like a obstacle there, and this obstacle, what it makes is that your lungs are more inflated. So once again, to reduce the atelectasis or the lung collapse. And just wait, just be hydrated as well. So instead of just drinking plain water, if there's 1 or 2 days you don't eat anything at all, I would recommend against just drinking water, because that can actually dehydrate you more, because it's hypotonic, so it doesn't have electrolytes, and you're putting some just plain water, and the electrolytes will go out of the cells just because of the gradient that you're producing, and you'll pee this out and you'll dehydrate quicker. So what you want to do, if you're not eating at all, I would buy real patented approved rehydration things. So Pedialyte is an option, or electrolyte is an option in Latin America, or Element is another option here in the United States, that you just got the electrolytes without not many sugars added, because of course the usual Gatorade, Powerade, these things don't even have the right mix of electrolytes and have a whole lot of sugar. So that's the recommendations. I would try that for 3 to 5 days, and if after 5 days you're worsening, or your fevers keep on going, or your symptoms are worsening, I would contact the doctor. Or if you have a whole lot of risk factors and you're just starting off with these symptoms, I would probably contact your doctor right away, just to be sure. But if you're a healthy individual, I would just give it 3 to 5 days doing all these things I'm mentioning, and that's the recipe for success. I believe that could help you as well. So that's it. Call this video a wrap. Let me know if you have any questions. As you can see right now, I'm undergoing an upper respiratory infection. I'm doing all those measures, and of course I'm already feeling much better, and yeah, back to work tomorrow. That's the idea. See you later.